There are now 3 FDA-approved therapies for hidradenitis suppurativa, or HS, but a recent survey of 500 HS patients found that about 75% were unaware of these treatments, and 56% said that their healthcare provider had not discussed these options with them. Part 1 of this 2-part episode of Beyond the Headlines explored the survey findings with an eye on closing up this awareness gap and getting HS patients the care they need. In Part 2, Dr. Adam Friedman, professor and chair of dermatology at the George Washington University School of Medicine and Health Sciences in Washington, D.C., and Brindley Brooks, the founder and executive director of HS Connect, play a game called What Not to Say to an HS Patient and uncover a lot about patient care and expectations in the process.
Something you said kind of just inspired a game I'd like to play with you called What Never to Say to an HS Patient. So I'd love to hear how you would answer that if you had to hit the buzzer and respond. What should you never say to an HS patient?
You should never say to an HS patient, especially on the first visit, anything about weight or smoking. That is a rapport conversation that needs to be built. And the reason that I say that is because it takes a lot for an HS patient to come into an office. It means that our quality of life has suffered so greatly, and most of us are beyond, Hurley 2, although it's outdated at that point, because we have carried so much shame and stigma. And there's a lot of self-blame that happens with HS. So having that discussion on the first visit, all it feels like to an HS patient is that you're putting that blame for their disease right back on them. What I would suggest saying is your HS is not your fault, because that is what we truly need to hear. So I'll give you a positive for every negative.
Love it.
I would say not to tell people that this was a personal thing that happened to me that really changed the course of my treatment as well. Not to put people in a box. So although there's been a lot of statistics that have flown, around everywhere, having to do with HS, not to put people in a box, not to tell people that it affects affects women more than men, not that it affects African American women more, because if you don't fit that stereotypical box we've created for HS, that also has huge psychosocial implications and makes people feel like they don't fit the disease, the disease itself. And so I think that's really something to be aware of. And on the flip side, I think we need to make sure that we talk about that it can happen to anyone, anywhere, anytime. So although we have statistics that say specific times of life that it happens more often, we're leaving out a lot of people when we're identifying only those things. And I think the last thing would be, for me, it's definitely where HS occurs. And I think that's where a lot of misdiagnosis happens, is to only say that it impacts A, where there's sweat glands, which is completely inaccurate, or B, where skin rubs together. Yes, it's more common for HS to occur where skin rubs together, but it is not the only place that HS can occur. It can actually occur anywhere on the body that there's a hair follicle. So anywhere other than the palms of your hands, soles of your feet, and the red part of your lips are susceptible to HS. And I think as long as we're keeping those things in the forefront, that we can absolutely make sure that more physicians are diagnosing properly, that patients come in and know that they have HS, as opposed to coming in with a question. They have more of an opportunity to come in with an answer.
Well said. I mean, for me, some things I want my patients to know, and kind of maybe sticking with the theme, is what isn't HS. So I want patients to know this is not an infection. You hit a big one that always, for a new patient, not your fault. If anything, we can maybe blame a family member because it is genetic, but short of that, it is not your fault. I think it's also not just a skin disease. And I think that's an important point. Often skin disease is minimized because, hey, it's just the skin, no big deal, right? Wrong. We know that probably every chronic inflammatory skin disease has a systemic piece. This is a systemic disease. And I really like getting into, even before we start talking about therapy, whether it be on or off label, that this is a systemic process, that we're seeing how this inflammation is affecting the skin. Well, guess what? It's also affecting the joints. It's affecting other organ systems. And so just treating the skin is ignoring a bigger problem. So then when I talk about systemic agents, it's not such a crazy idea. Like, well, it's just a skin problem. Why do I have to give myself an injection? Why do I need a pill? Well, no, no, no. You're seeing the skin piece of a bigger picture. So I think those are the three big things I want patients to know that about in terms of what HS is not, rather that HS is a chronic inflammatory disease that they did not cause, that can wreak havoc on everything. And therefore we have to take a holistic approach.
Yeah, and to your point, you're exactly right, because all we're seeing is the outward piece of that. We're not seeing that chronic inflammation. We feel it. We know it's there. But I think it becomes natural at a certain point that you don't acknowledge it anymore because it is just your daily. And so I think there's a huge difference when people aren't experiencing that anymore once they're on a medication, to see what that actually looks like, to not potentially live with that all the time. And I think there's a lot of things that happen with HS that we're so unaware of that we get. It's not outwardly shown, like the brain fog and some of those kinds of things, the fatigue, that are not necessarily well known or talked about as symptoms of HS. So we often fall under the, oh, something must be wrong with you, or oh, it's just, but part of that is that inflammation that's constantly happening inside of our bodies, but we're not aware of those things. So I think it is really important, to your point, to make sure that patients understand that there's also a risk to not doing anything about your HS.
Oh, I love that. What is the harm of not treating? I bring that there's certain lines I think that can really get someone on board with what you want to do. And one is, okay, you're so worried about the side effects. What is the harm of us not treating? I can guarantee you what will happen if we don't treat you. The other things, those are, small percent of patients, and we can manage those things. So it's all about putting into perspective. And I think that, you hit on such important points about how it even feels to have chronic systemic inflammation. And I would argue, and this is kind of similar to atopic dermatitis patients, that because patients often are doing badly for so long, it's normalized. So we mentioned that 7 to 10 year delay. You have a patient who's never been properly treated, their baseline is bad. So you can't say to someone, hey, how are you doing? I'm okay, because their okay is not okay. And until you treat them, they don't actually recognize, like, whoa, I really wasn't okay. And so that's, I think, another important thing, maybe more for practitioners than the patient, to ask more pointed questions, not say, hey, how you doing? I'm fine. Well, what's your pain level? Well, that's pretty bad. Are you able to sit for long periods of time? Can you raise your hand for me? There are things we can do, have the patient do, to really illustrate how bad they're doing. But I think HS patients in general are tough and they've gotten used to it. And so they're not going to volunteer that unless you ask them in a very targeted manner. And so you can miss the severity if you're not thoughtful about that.
Yeah, absolutely. And I think that goes with pain too, because for a lot of us, it's not something that is dealt with. We're not offered options as far as pain management goes. And that's really difficult as a patient, because you ask me what my pain level is, or on a pain scale where I'm at, but we don't ever talk about it. And we don't have very many options for patients who are dealing with chronic pain. And this disease is so incredibly painful. I mean, unbelievably painful, and in so many different ways. So I feel like we need to kind of go back to the drawing board on that. I feel like the pendulum has swung a little bit too far to the other direction of trying to be overprotective when it comes to dealing with pain, and that we need to find some kind of a middle ground that we can all agree on, that allows patients to have their own way of dealing with things, or the option to, if they need some kind of medication, but not to the point where it becomes a chronic thing. And I think that some of that is something that we could very easily kind of come to a middle of the road on, but we need to start that conversation so that our patients feel heard and validated in their disease. Because that is one thing that I know the patient community definitely feels like they're not heard and not validated in. And some of that with these medications, though, helps the pain level incredibly, because if you're not having those flares as often or at all, then that pain level decreases hugely. So again, it goes back to the what is the drawback of not trying a medication. There are inherent risks in everything we do every single day of our life, but we don't think about those until they're written out on some kind of a leaflet or on the side of a box. And so, you're susceptible to get cancer at any point in your life. It does not mean that because you take a biologic that you are inherently going to get cancer. it means your risk may be slightly higher, but your risk may be slightly higher as well if you're an outside worker. If you know, spend a lot of time outdoors and are more prone to skin cancer. Literally, you guys, it's anything and everything. So if it's affecting your quality of life so greatly, to me, there's the risks, the benefits far outweigh the risks as far as that goes. And I think that you don't know how incredible your quality of life can be until you reach the point where you're ready to go ahead and give those things a shot.
I like your word selection of give it a shot, giving it a shot.
That was really funny.
That was very funny. I kind of want to wrap up on one point about pain, and I'll be very transparent. As dermatologists, we are not trained in meaningful and proper use of pain meds, and that makes sense, right? It's not really central to what we do. And I will say there were several really nice papers years ago in the Dermatology Online Journal, which is a free journal, easy access, just put pain management, hidradenitis. I think there have been some since that really give very practical guidance on how to use a wide array of medication that can be useful for pain, like gabapentinoids. Obviously, there are some narcotics that we use. I mean, there are pros and cons to everything, but we know, for example, that if someone is in pain, they heal slower. That pain induces more inflammation. So it's that balance of harm of treating, harm of not treating. And so I would encourage in general, and I think this is also guidance to myself, that we do need to include pain management strategies as part of curricula in residency, at meetings. Let's circle back and see if I actually implement this stuff, because I think it is important. And I think we have to be thoughtful about pursuing that, because it's not part of our wheelhouse typically. And so I think there could be opportunities to give some basic education on how to use these. Maybe publications like Dermatology Digest. I don't want to get crazy here, push someone, but there could be a nice supplement about this. I don't know. What am I saying here? But regardless, I think that we are so focused on itch, but there are many conditions that itch, but also are painful and are super painful, but also itch. HS can itch as well. So I think we have to, once again, it's about asking questions. What does it mean when I say, how are you doing? I say, hey, is this hurting? Also ask, does this itch? Because we have treatments to manage inflammatory itch, or whether it be itch from irritant contact dermatitis. We want to make sure we're covering every piece of it. So I think the end all be all it is, ask lots of questions, invest in the time. That first visit's going to take some time. It's okay. You're going to run behind. Someone might get upset. Who cares? You've made an impact, and that next visit is going to be even easier. And the visit after that, because these can easily be lifelong patients. But most of all, it's so important to ask these questions even broader through very low-hanging fruit type research projects that students can be part of to learn more about a condition like hidradenitis, through survey tools, and of course, very important partnerships with amazing organizations like HS Connect, and of course, the amazing Brindley Brooks. So thank you for having this conversation with me, and I hope everyone enjoyed and learned something from this, and can take a nugget back to better manage your HS patients tomorrow and the day after that.
Yes, thank you so much. I'm going to make one more quick plug, which is that when you start asking your patients after May 1st of 2025, how they're doing emotionally, you now will have a place to send them, because HS Connect is developed an online mental health program for patients called Healing Space, which is going to launch on 5/1. So I know that it's been a topic of conversation in the community. What do I do with my patient if they say that they're not doing well emotionally? And we have developed an answer to that, actually based on a conversation that you and I had in the past. So effective May 1st, we will have that available up on the space, hsconnect.org. So please feel free to send your patients there. We are here for all of their needs and to be an outlet for you guys to use for your patients as well. So thank you again for the conversation. I appreciate it.
Thanks for listening to this episode of Beyond the Headlines. We hope you learned more about how to care for patients with HS. Check back for new episode drops monthly.